Hi. Today we're going to talk about the most important aspect of asthma control, and that's delivering the medicine down into your lungs where they're going to do you the most good. Now, if you or your child has asthma, you've likely seen one of these. This is an albuterol inhaler. Now, if you've seen somebody take this medicine in the movies, like The Goonies, or unfortunately in real life, what you've probably seen is them putting it into their mouth, taking a deep breath, and spraying. If you've never seen this outside of someone's mouth, it looks like this. There's a fine mist of medicine, goes out about this far very quickly. I'm not going to go into the physics of it, but essentially, if you place this in your mouth, take a deep breath, and pump it, unless you match the speed in your inhalation of each medicine particle, you're going to create turbulent flow, which is going to cause that medicine to spin off to the sides and deposit in your mouth or in the back of your throat, where eventually you'll swallow it, and it's not going into your lungs and doing the most good. For that reason, most pediatric pulmonologists will recommend the use of a device like this. This is called a spacer. The purpose of the spacer is to catch the medicine in this column of air, where your child can then breathe in that air at a comfortable pace, and more of it's going to get down into your lungs. Now, this is a spacer for a younger child. You see it has a mask, which is going to cover both the nose and the mouth. They do make spacers for older children with just a mouthpiece, for kids who can make a firm seal with just their mouth. The most important part of this spacer is right here. This is a one-way breathing valve for you as the parent to see if your child is taking deep enough breaths to move that valve. That means he's taking deep enough breaths to move the medicine from this air chamber into his lungs. Using a spacer is very easy. First, you're going to get your albuterol inhaler. You're going to shake it up to mix the propellant and the medicine together. You're going to put the inhaler into the hole in the back of the spacer. Place the mask on your child. Watch the breathing valve to make sure that there's a good seal and he's taking good breaths. Pump the medicine. For a younger child, you want him to move this valve about 10 times to move the medicine down into his lungs. For an older child, you can have him take a deep breath and hold it for 10 seconds. That will also get the medicine down into his lungs. A note about cleaning the chamber. There is an electrostatic charge on the inside of this plastic piece, which prevents the medicine from sticking to the sides of the spacer. You want the medicine in the air so that it will move down into your lungs. If you clean the chamber and dry it by rubbing a towel on the inside of this device, you run the risk of ruining that electrostatic charge, and your medicine's not going to work as well. You can clean these with warm soapy water, but then just let it air dry. It'll dry eventually. A note on albuterol. Remember, albuterol is a rescue medicine which treats the symptoms of asthma, but does not treat the underlying cause of asthma. That takes other medicines, which you should talk to your pediatrician or primary care provider about. This inhaler has a counter, which shows how many doses of the medicine are left. Unfortunately, most generic albuterol does not have a counter on it. And the way the inhalers work is there's a propellant inside that outlasts the medicine. So it's potentially, you could have run out of medicine and still see things spray out of the end of the inhaler. If your albuterol does not have a counter, I recommend putting a little sticker and putting a mark every time you give a treatment. So that way you can count how many times you've used it and you know how many treatments you have left. Most albuterol inhalers contain about 200 puffs. You'll want to read the instructions and make sure you know exactly how many times you can give it to your child before you need a new one. As always, this video is just for educational purposes and is not meant to diagnose or treat any conditions. If you have specific questions about your disease or your child, please talk to your doctor. Otherwise, if you have general questions, comments, or other suggestions, please put them below and I'll get to them as soon as I can. Thank you for watching.